All right, then. Good morning to everyone. I'll ask you to go ahead and grab a seat. We will go ahead here and get started. Okay, well, good morning to everyone. My name is Kathy Temple. I'm the Director of Employee Experience, and without a doubt, this is absolutely my favorite day of the year. It is I'm filled with a lot of pride, and it certainly is my pleasure to be the host for our event today, and so amazing to hear so many great stories from so many of the folks that work here. To start off the celebration, I'd like to invite Dr. Barish to open up with a few words.
Thank you, Kathy. And not only is it her favorite day, but it's my favorite day, too. And for those who don't know me, I'm the Vice Chancellor of Health Affairs and oversee the 7 health science colleges and the clinical enterprise through the hospital and clinics and Miles Square and Cancer Center report up to my office. So it's great to be here, and it's great to welcome all of our nominees and their families and friends for this year's Hospital and Clinics Recognition Ceremony. I know we have a lot of family, which is fantastic. So I must first take this opportunity to congratulate everyone for their efforts leading to UI Health achieving magnet recognition status this summer. Where's Ty? All right. This is great. So this is among the most prestigious designations a healthcare organization can receive for nursing practice and quality of care. And Ty was more than 10 years in the making, so unbelievable. So indeed, this new accreditation recognizes our commitment to provide access to the highest level of clinical excellence for the patients and communities that we serve. Everyone across UI Health plays an important role that drives the mission of our hospital and clinical operations. So today, we come together during this annual recognition for UI Health staff and physicians, bringing together some of the most remarkable members of our care delivery team to pay tribute to their significant contributions and their service. The people we are here to honor this afternoon embody our greatest aspirations to serve the communities who depend on our knowledge, our research, discoveries, and our compassion to advance the health of our communities. We hold this annual recognition celebration to showcase our Employee of the Year, the Advanced Practice Provider of the Year, the Resident of the Year, Physician of the Year, and the Joseph V. Abraham Leadership Award recipient, and we acknowledge Nurse Excellence recipients and Award of Merit recipients. So, all those nominated should be recognized as the current and future leaders who will continue to have a great impact across the healthcare professions. So I look forward to applauding each of the prominent individuals who were selected to be recognized this year for their contributions and service to our patients. I want to congratulate everyone again in advance and to extend my gratitude for all of you and all the work that you do to elevate us and for the distinction you bring to our academic health enterprise. Thank you again.
Okay, don't go far. Okay, so now either side of the blue tape is where you should go. Okay, good. We have to clear that up to get started. So to kick off, let's invite, I'd like to invite Dr. Rosenblatt to please join us on stage. We're going to go ahead and Ty, please, as well. Our first award will be that of our Nursing Excellence, the Excellence in Nurse Leadership Award. These awards acknowledge UI Health nursing staff nominated by their peers for excellence in leadership, mentoring, professional practice, and quality. Each of these awards recipients were named earlier during this year during our annual nurses celebration. And I'd like to call your name. Please come on up and join us on stage if you are here. Kim Andrews, I know you're here. Come on up, Kim. Kimberly Chow. Karen Dancy. Mercy Jeevan. Tanya Monteoka. And not able to be with us today is Lynette Brown and Vinci Chaco. So how about a round for all of our excellence winners? Award winners in the middle, scooch over. It's like really bad prom, everyone stares. I like it. Congratulations again. Ty, thank you. All right, next I'd like to introduce you to our 2025 Award of Merit recipients. The Award of Merit is given annually to 10 UI Health employees who demonstrate overall excellence in aspects of their work. They are a role model for our eye care values, and they demonstrate a patient-first mentality. The Award of Merit recipients will be formally recognized in November, where they will receive a small memento and a check for $3,000. I see a lot of lunches in our future. When I call your name, please come join us on stage, and I'm going to share a little bit of this person's nomination packet with you after I call their name. Let's start with our friend Carrie Best, medical social consultant from Care Coordination. Carrie possesses a wealth of social work knowledge and extensive knowledge of resources to compassionately engage patients during every encounter, while also providing education and resources. She does this by addressing housing, food transportation insecurities, mental health, and domestic violence concerns to help improve the overall health of the patient while reducing barriers to medical care. Congratulations. Oh, you got to be on the blue square.
Blue dot, everybody, blue dot, right here. Okay.
Recipients, nominees, blue tape. We run a tight show.
I can't follow you.
Next, I'd like to introduce you to Ryan Frank, Revenue Cycle Process Improvement Manager from Patient Accounts. As a part of the revenue cycle optimization team, Ryan's work has improved system integrity and streamlined financial processes, ultimately supporting better patient financial experiences. His analytical approach, combined with hands-on collaboration with the necessary teams, has resulted in measurable performance improvement and greater transparency. Ryan, congratulations. Next, let me introduce you to Dina Johnson, ophthalmic medical technologist from the Department of Ophthalmology. Dina's management style is one that emphasizes empathy, servant leadership, and a commitment to the well-being of her team. Her actions consistently reflect her genuine care for her team and her unwavering commitment to fostering a supportive work environment. Dina takes whatever comes her way with a positive attitude and an unrelenting dedication to the success of the clinic and the well-being of her team. Dina, congratulations. Next, let me introduce you to Dawn Majeria, Healthcare Administrator 2, Nursing Services and Analytics. I'm going off script here, but Dawn was very, very instrumental in our magnet designation, so very well deserved. Dawn fosters collaboration across diverse disciplines simply by her day-to-day encounters, which take her most anywhere in the hospital. She provides unwavering support, encouragement, and empathy to the entire nursing division. Although she does not provide direct patient care, she strengthens the teams that care for our patients and helps build an environment rooted in quality, safety, and collaboration. Well-deserved congratulations. Next, let me introduce you to Sherilyn O'Shea, Clinical Nurse Consultant 2, Infection Prevention and Control. Sherilyn's leadership and expertise have directly contributed to significant reductions in hospital-acquired infections, including a nearly 44% drop in CLABSI rates and maintaining 0 infections for 4 years in a step-down unit. She is known for her proactive collaboration across disciplines, implementation of evidence-based practices, and dedication to staff education, all of which have improved patient outcomes and safety system-wide. Congratulations. Next, Sarah Rios, Assistant Director, Clinical Research Finance Office. Sarah consistently demonstrated a willingness to help others. She has shown exceptional leadership by streamlining standard operating procedures and improving workflow efficiency. Sarah fosters a positive team environment by encouraging growth and boosting morale. She celebrates team successes, provides constructive feedback, and motivates others to reach their full potential. Congratulations. Next, Marie Romero, Staff Nurse 1, Labor and Delivery. Marie goes above and beyond to make sure that all patient and family needs are met. She considers the entire family dynamic and supports them as part of the team. Marie is sincere and empathetic in her approach, often taking the time to sit and just listen to her patients. She advocates extensively for her patients and is a bright light for all. Congratulations. Unable to attend with us today are Victoria Smith and Denise Fields. And again, all of them will be recognized in November. So Award of Merit recipients, congratulations. I would next like to introduce you to the nominees for the Joseph V. Abraham Leadership Award. Established in 2021 in recognition of Joe Abraham's retirement, this leadership award honors Joe's work and 31 years of service at UI Health and Imaging and Diagnostic Services. This award is meant to motivate hospital staff to pursue leadership opportunities in imaging and diagnostic services at UI Health, including pursuing higher education and accepting promotions when the opportunities arise. It is my honor to welcome Joe Abraham back to UI Health, who is here to help us. And Joe, if you wouldn't mind, please come on up. I'd like to also invite Dr. Michael Bresler, Vice Head of Clinical Affairs for Radiology, to join us as well. All right, and nominees, when I call your name, please come on up on stage. Samantha Estrada, mammography technologist. Samantha goes above and beyond to ensure that every patient not only received exceptional imaging care, but also an experience grounded in dignity, empathy, and respect. Samantha delivers care that is both technically precise and profoundly human. Samantha, congratulations. Next up is Monique Long, also mammography technologist. Monique is an outstanding technologist whose professionalism, compassion, and commitment to excellence consistently elevated the standard of care in the breast imaging department. Her dedication and contributions have not only improved patient care, but also strengthened the culture of the department. She's out. Monique, congratulations. Next, we have Stephanie Moncayo, Information Services Supervisor. Stephanie excels in coordinating complex scheduling needs, often juggling high volume of requests, last-minute changes, and patient concerns, all while maintaining a calm, friendly demeanor. Her ability to communicate clearly and compassionately with both staff and patients, fostering trust, and she definitely contributes to our smooth operation. Congratulations. Next up is Vaibu Rana, radiological specialist. Vaibu has continually sought to expand his knowledge and skills in the field. He is a good teacher to the radiology students and a strong source for technical knowledge. He never hesitates to pass on his knowledge to his peers. He makes excellent quality images and is empathetic to all of his patients. So congratulations. Samir Rashid, medical radiographer 2. Samir is a very knowledgeable and strong member of the Cath Lab team. His quiet confidence and calmness help his team persevere even through the most stressful cases. Samir is engaged in quality improvement efforts, aiming to contribute to better care and operational efficiency. Congratulations, Samir. Next up, we have Ayman Shalan for a vascular ultrasound specialist. Brand would be his exceptional work ethic, pride in his work, the quality of his work, and lastly, the care he extends to our patients. His willingness to step in, often without being asked, and follow through with updates ensures workflows remain smooth and that issues are addressed swiftly. Congratulations, sir. And our last nominee for the Joseph V. Abraham Leadership Award is Danupa Zacharias, Staff Nurse 2. Danupa spends significant amounts of time with patients, exhibiting incredible patience and compassion to guide them emotionally through their treatment plan. One of her standout contributions has been her leadership in revising and aligning our patient education program to meet APEX accreditation standards. Congratulations, Danupa. Okay, now it's time. Now that you've met all of our nominees, I'd like to invite Dr. Bressler to now tell you a little bit more about our recipient.
Well, thank you. It brings me great pleasure to announce the Joseph V. Abraham Leadership Award recipient. Let me start with a few words to describe our recipient. Exceptionally skilled, uplifting attitude, deep compassion, a sharp eye. Our award recipient is one with unwavering commitment to not only their patients, but UI Health overall. Their expertise is at the highest level, and they are meticulous when obtaining imaging. Our recipient's ability to communicate complex procedures with patients, alleviating their anxieties, and explaining the importance of early detection speaks volumes of their empathy and commitment to patient care. Our recipient has received consistent praise through our press-gaining satisfaction scores, highlighting empathy, warmth, and ability to make stressful experiences more comfortable. Her ability to anticipate clinical needs and proactively support patients and physicians has made her a trusted and respected member of the care team. This individual has been a valuable member to newer technologies, offering guidance, training, and support to help them develop their technical skills and confidence. Her willingness to share knowledge and foster a collaborative, positive work environment has made our team stronger and more cohesive. It's my pleasure to announce Monique Long.
Hey, Monique. Hey, Monique. Surprise! So in case you can't see it, Monique does receive a $1,000 check and an award. So once again, well, congratulations. We can be a little sneaky if this is your first time here. I have one, I missed, and then I missed one award of merit, and I do apologize. Miss Maria Gomez, I know you are here. I so apologize. Maria is a certified medical assistant at our 55th and Pulaski location, and she was one of the first ones here, and I was chatting with her. I'm not sure how I just skipped over her name. So my deepest apologies, award of merit recipient. I don't think she's going to buy me lunch with her $3,000 check, but Maria's work ethic is not only admirable, but also inspiring to those around her. As one of the most experienced medical assistants in the clinics, she has become a go-to resource for colleagues. Whether someone needs clinical guidance, workflow support, or simply encouragement on a tough day, Maria is always there with patience, clarity, and compassion. So congratulations. Well deserved. All right, well, this year we are very pleased to have with us today a service award recipient who will be recognized in the formal ceremony in November, but she is celebrating 40 years at UI Health. So Ms. Stacy Taylor, I know you are here. Come on up, please, if you wouldn't mind. I'm gonna take you way back. Stacy began UI Health in 1985. And let me tell you a few facts about 1985. Gas, $1.12. We were introduced to the Calvin and Hobbes comic strip. If you were like me, Cabbage Patch was the rage. I'm saying. The top grossing movie was Back to the Future, and believe it or not, it was Michael Jordan's NBA Rookie of the Year. Stacy, congratulations for 40 years of service. All right, we're now going to move on to some of our of the year nominees and name our recipients. All of our of the year nominees exemplify UI Health's eye care values. They put the patient first. They display UI Health's mission driven as one ethos. They collaborate across teams, and they foster an environment that encourages respect. Each of our employee of the year recipients were selected by a multidisciplined group of peers, and at no time do myself or any of our executives participate in the review or the selection. So our Employee of the Year, we're going to start there. Our Employee of the Year nominees were recognized throughout 2025 as either a Class Act recipient or a DAISY recipient. Those are two of the highest honors we present here at UI Health. You kind of know the drill. When I call your name, make your way up to the front, please. So we're going to start with Ina Bautishoff, IT Manager, Labor and Delivery. Ina has been a key player in any implementation and monitoring within her unit and department. Ina is responsible for compiling data for our reporting metrics, both internally and with regulatory bodies. With many of the reports having numerous data points, being a very tedious task, Ina handles it quickly and without fuss. She is a true gem to the team. Congratulations. Rachel Francisco, Administrative Nurse 1, Neurosciences. Rachel's ability to build trust and meaningful connections with patients is extraordinary. She leads with clarity and purpose, consistently going above and beyond to ensure patient safety and positive outcomes. Her tireless efforts and exceptional care have made a profound difference in the lives of countless patients and their families. Congratulations. Our next nominee is Tyrell Funkhauser, Occupational Therapy Specialist. Tyrell has a strong clinical skill set and has expanded his expertise to include more specialized areas of his discipline. He is committed to putting the patient first, which is seen as an unwavering focus on patient care and patient access. He leads the therapy department with the highest level of productivity. So Tyrell, congratulations. Next, we have Felicia Meadows, Customer Service Rep from Radiation Oncology. Felicia's ability to connect with patients through empathy, professionalism, and genuine care is unmatched. She brings a calming presence to what can be a very stressful time for many. In a department that can be emotionally heavy, where patients fight for their lives and sometimes lose, Felicia remains a beacon of light as her joy is contagious. Congratulations. Next up is Junelle Paguli-Guhan, staff nurse from Perioperative Services. Junelle consistently advocates patient safety, ensuring every patient encounter is handled with attentiveness, respect, and clinical excellence. As the driving force behind the development and implementation of the ultrasound-guided intravenous program, she has significantly improved vascular access success rates and helped reduce delays in patient care. Congratulations. Next up is Elizabeth Ray Goza, medical social consultant. Elizabeth uses a strength-based approach and works with patients to collaboratively solve a wide range of barriers that our patients may face, including financial insurance concerns, communication with medical teams, coordinating with outside facilities and service agencies, concerns with obtaining needed medication or medical supplies, support at home, and so much more. Congratulations. Also nominated but not able to attend were Ashley Sicard, Emma De La Cruz, and Roberto Rosales. So now that I've introduced the nominees, I'd like to invite Dr. Rosenblatt to announce our recipient.
Thank you so much. It gives me the greatest pleasure to be able to introduce to you our 2025 Employee of the Year. Let me start by telling you a few things about our award recipient. Teammates seek their insight and mentorship. This manages to be a person that covers everything in the department effortlessly, quick to lift colleagues with shout-outs and recognition, embodies the type of professional we want representing our health system. In a few ways, our Employee of the Year has been described. Our Employer of the Year has a quick, infectious smile that somehow lets everyone know that everything will be all right. They're quick to offer suggestions and share their knowledge, yet are equally open to hearing suggestions and learning from others. Our Employer of the Year is an expert in their field, and they are the go-to person in their clinic. Award recipient has a proactive pursuit of knowledge and a strong willingness to share that knowledge through in-services. Our award recipient specializes in treating post-gender surgeries. He formalized a protocol for affirming patients. He recently developed a bridge with Rush University to support their patients after gender surgeries. Ty is the person who shows up to help during fire drills, organizes and orders supplies for the team, is an early adopter of department change, and has a strong business acumen. Ty volunteered to work with students from the Ambassadors Academy, part of the Urban Health Program. He developed a learning opportunity for them and engaged them in practice. He leads the entire outpatient therapy department with a yearly productivity average of 77.8%. And Ty's contribution to UI Health span clinical care, education, safety, innovation, and team culture. And he does all with grace and humility. So it's my distinct pleasure to introduce you to our 2025 Employee of the Year, Terrell Funkhauser.
Welcome. I told you we were sneaky. So I think the story goes, Ty had originally asked for today off, and you told him no. And he was like, why? Gets real quiet. Welcome, correct, please. Welcome. Yes, you're good, all of you, please. There's extra seats and tables on that side. Please, go. Oh, here. Oh, all your stuff. We have a new award this year to share with you. The Graduate Medical Education Office is proud to introduce you to the inaugural Program Coordinator of the Year Award. They announced this recipient just a few weeks ago, and so I'd like to invite GMAC and Dr. Michelle Barnes, Assistant Director of GME, to come on up and join us, if you will. The Program Coordinator of the Year is someone who embodies the value of UI Health, collaborates across the enterprise in support of residents and fellows, emphasizes quality improvement and innovation to elevate the residency fellowship program, and ensures a best-in-class experience for our residents and our fellows. It is my pleasure to introduce you to the first recipient of this award, Carolyn Marshevsky. Carolina, come on up. Here are a few things her nominators had to say about Carolina. She is the ultimate team player. For years, she served as the sole coordinator for both emergency medicine and combined emergency internal medicine residency program, and she helped us navigate our unique ACGME requirements with efficiency and clarity. Carolina consistently available, responsive, and easy to approach, and she embodies the words, seek first to understand. She has a strong ability to connect with people from all backgrounds and foster a sense of belonging. So Carolina, congratulations. Carolina, I will tell you, there is a trophy that is coming for Carolina. Unfortunately, the mail is what it is, and somehow they sent her award to Nashville. And so we are eagerly awaiting a new one today, Carolina, and we'll get that over to you as soon as it arrives today. I do apologize. All right, we're going to now move on into our Resident Fellow of the Year nominations. And so, don't leave. Dr. Barnes, you can't leave yet. Look, they're not following the rules. Okay, we're going to go ahead and start. And again, when I call your name, please do come up on front and join us. How about Nicole Alberti? Nikki is a solutions-oriented leader who consistently demonstrates the rare ability to drive big with grace, tact, and a collaborative spirit. She consistently demonstrates a remarkable commitment to her patients, her peers, and the field of medicine at large. Her evolution into a thoughtful, capable, and compassionate physician have both been impressive and inspiring. So congratulations. Next, let me introduce you to Allison Ellis from Dermatology. Allison is always diligent with unwavering dedication to her patients, peers, medical team, and staff. Her critical thinking, innovative mind, and motivation always stand out. She has exceptional bedside manners and a unique ability to adapt to the daily busy clinic schedule while providing an outstanding example to her peers. So Allison, congratulations. Next, I'd like to introduce you to Michaela Hamilton, resident from Pediatrics. Michaela is in tune not only with the clinical aspects of her patients' needs, but has a complex understanding of the barriers and social constructs that affect her patients. She uses this to not only provide excellent care, but to advocate for change that benefits her patients. So Michaela, congratulations. Our next nominee is Chelsea Herbert from Medicine. Chelsea wholly embodies UI Health's mission to advance health for everyone through outstanding clinical care, education, research, and social responsibility. She has twice been recognized for going above and beyond to protect patient dignity and safety. Her bedside manner consistently garners praise from patients' families and colleagues. Congratulations. Next, let me introduce you to Charlie Pierce, the resident from Radiology. Charlie brings remarkable dedication and attention to detail, ensuring that all aspects of the residency are running smoothly. His tireless efforts have made a lasting impression not only on his fellow residents, but also on medical students seeking mentorship and opportunities for research and professional development. Congratulations. Next, I'd like to introduce you to David Rode, a resident from Radiology. One of David's most impactful initiatives has been the development of the Call Readiness Test, a system that uses curated emergency cases and PACS to evaluate whether residents are prepared to take calls. David's creation of a structured training program ensures that junior residents have the knowledge, confidence, and readiness to handle complex situations. Congratulations, David. And our last nominee to introduce you to is Jillian Sation, a resident from Family and Community Medicine. Jillian has all the qualities you want in a doctor: compassionate and patient-centered with strong medical knowledge, history, physical exam skills, case presentation, patient management, and collaboration. But more than that, Jillian embodies the quality of the good citizen and the team player. Her adaptability, problem solving, and commitment to our family medicine residency's team success is extraordinary. Jillian, congratulations. Also nominated but not able to attend were Mary Abkemeyer, Nicole Blumenstein, Rebecca Garber, Kevin Hensel, Priya Kantasaria, Jesus Perez, and Saeed Khalid, and we congratulate them all. All right, it's that time. Dr. Radosta, will you please do the honors?
All right, good morning, everyone. It is my great pleasure to be able to introduce the winner of our Resident of the Year Award. I'll start off by congratulating all of our nominees. There were more nominees this year than I think any other year. So congratulations to our residents for always raising the bar. When I was a resident here a long, long time ago, no one was nominating me for awards. And you guys are well beyond anywhere I was. So congratulations to every one of you. So it gives me great pleasure to introduce our 2025 Resident of the Year. Let me start by telling you a few things about our award recipient. Extremely thorough, provides excellent oversight to interns, a humanistic physician, a tireless advocate. These are just a few words to describe a Resident of the Year. Our Resident of the Year has been consistently praised for by supervising physicians and peers for demonstrating a high amount of autonomy in their diagnostic reasoning, having an empathetic bedside manner, and dynamic leadership skills. One attending physician commented on our Resident of the Year. They said our recipient demonstrated exceptional skill in managing a high-stress environment, all while maintaining a calm, composed demeanor. Our award recipient has served as a mentor and sounding board for many residents in the program. As a non-judgmental listener, I need to learn from that, a non-judgmental listener, and advocate for their colleagues, they have organically fostered an environment of welcomeness and inclusivity within their program. Whether managing complex ICU cases or leading inpatient wards, our Resident of the Year tailors care plans that respect each other's culture, linguistic, and socioeconomic context. This person has completed their Global Health Scholars Tract and recently delivered virtual didactics to Zambian medical students. Her forthcoming initiative, Project Band Together, will supply endoscopic banding equipment to under-resourced hospitals. This endeavor pairs compassionate service with sustainable system change. Chelsea received a $13,000 Advancing Racial Equity Award from the Office of Diversity, Equity, and Engagement to fund her creation of the Careers and Mentorship in Medicine program, also known as CAMMP, CAMP. Through this grant, she is creating community outreach programming to mentor medical students, organize community health fairs, and introduce underrepresented high school students to healthcare careers. She has led sizable efforts to establish a Diversity, Equity, and Inclusion Council in 2024 within the internal medicine residency program. This year, she transitioned into our inaugural DEI Chief Resident role, in which she will develop initiatives that promote synergy between the residents of the DEI Council and the faculty members in the Department of Medical Inclusive Council. Chelsea's reliability, humility, and commitment to service foster a spirit of collaboration that makes anything feel possible. These are just a few examples of the incredible work that she's done. It gives me great pleasure to announce our 2025 Resident of the Year, Chelsea Herbert.
Chelsea, a surprise! The extra large Uber version. All right, scoot in. We gotta double up. Scoot in. Get in the middle. Scoot. Let's go. Kids up front. Kids up front. Yeah, you guys scoot up to the front row. Mom's gotta be up front.
Good.
Come on, there's more room. Let's go. Oh my God, there we go. There we go.
Oscar, you get them in here?
Nice to see you all. Chelsea is buying tonight. Oh. She's like, she just hates everyone. Oh, wait, do she need tissue? Huh? Oh, she needs tissue. Don't leave. Oh, that was like, not fun. It's like my favorite day of the year. Okay, I'd like to now, we're going to announce our Advanced Practice Provider of the Year Award. And so, Ty, if you wouldn't mind, come on back up with us. Again, when I call your name, please join us up on the stage. Jean Arsbicker from Neurology. Jean has a compassionate yet matter-of-fact style that puts patients and their families at ease as they go through harsh therapeutics, radiation treatments, and surgery. She is a tireless patient advocate, ensuring everyone is seen, heard, and cared for holistically. Jean is not only a critical member of the neuro-oncology division, she is the heart of it. So Jean, congratulations. Next up is Kelly Clemens, Hematology Oncology. Kelly's ability to navigate challenging situations with grace and professionalism has earned her the gratitude and respect of our patients and her colleagues. Whether managing complex treatment plans for patients with hematological malignancies or supporting families through difficult decisions, she places the patient at the center of every encounter. Congratulations, Kelly. Next is Allegra Connors from the Miles Square Health Center. Allegra is passionate about supporting patients and raising awareness for the evidence-based treatment of behavioral health and addiction. She has worked tirelessly to ensure walk-in, scheduled, and hospital follow-up access for patients with serious mental illness and behavioral needs. Allegra listens attentively to both her patients and staff, offering guidance and care in ways that are both practical and compassionate. So congratulations, Allegra. Next, we have Sarah Haas from Transplant. Sarah delivers care that is not only medically excellent, but also deeply human. She meets people where they are, providing support that is attuned to their immediate needs. Sarah navigates the complexities of multidisciplinary care with grace, serving as a trusted liaison between surgery, nursing, pharmacy, social work, and care management. She shows up fully every day, always focused on the mission. Congratulations. Next, let me introduce you to Melba Haberlin from Pediatric Gastroenterology. Melba possesses a rare combination of clinical expertise, meticulous attention to details, and an unwavering commitment to family-centered care. Melba plays an integral role in the care coordination amongst providers, dietitians, social workers, and school health professionals, ensuring seamless support for our patients across all settings. It should also be noted that Melba went to nursing school at UIC, obtained her APN from UIC, and is now pursuing her PhD, again, at UIC. Congratulations. Next, let me introduce you to Janie Kotler, Emergency Management. Janie consistently places the patient at the forefront of every encounter, ensuring her plans and management of the patient are appropriate. As a practice mentor for nurse practitioner students, she leads multiple quality improvement projects, including enhancing sepsis outcomes and reducing time to pain management for patients with sickle cell disease. So congratulations. Next, I have Julie Leung from Obstetrics and Gynecology. Julie understands midwifery's power to decrease the maternity, morbidity, and mortality rates. She defends the most vulnerable patients. She works with a diverse population and is sensitive to cultural needs. Julie is a role model for the less experienced midwives and instills in them a positive outlook for affectionate change. Congratulations. Next, I'm going to introduce you to Joyce Masterson from Pediatrics. Joyce's clinical expertise focuses on brain disorders and child developmental and behavioral delays. She entwines the complexity of her patients' disorders with an ethos of aligning patients' and families' needs with purpose and actions in support of achieving advancement of short and long-term goals. Joyce enjoys teaching families how to embrace their child's differences and how to advocate for their children by partnering with community resources and school districts. So Joyce, thank you. Next up, I have Jessica Petritsky from Dermatology. Jessica performs at a high volume while still providing exceptional patient care with efficiency and compassion. Her ability to manage complex cases, keep thorough documentation, and address patients' needs promptly has made a significant impact on both patient outcomes and team workflow. Her leadership, initiative, and unwavering professionalism make her a true role model amongst her peers. Congratulations. Next up, we have Marta Sieben, cardiothoracic surgery. Marta's technical precision and poise in the operating room have earned widespread respect from her surgical colleagues. Marta knows her patients in remarkable details and navigates complex clinical situations with grace and clarity. Marta has played a pivotal role in the education and mentorship program, dedicating significant time to training staff on best practices in critical care management, enhancing patient safety, and optimizing outcomes. Congratulations. And last but not least, our last nominee is Su Young Yong from Gastroenterology. Su Young provides meticulous and excellent patient care. She is always proactive in learning something new. She puts herself in the place of patient and their families and is always compassionate and caring, even with difficult patients. Sue is always smiling, thereby projecting kindness, love, and a positive mood to all of those around her. Congratulations. Okay, and then it's time. I'd like to invite Dr. Hughes Diller to announce our recipient.
All right, guys, let's get ready. Okay, here we go. It is an honor to share with you a few more details of our Advanced Practice Provider of the Year. Our Advanced Practice Provider of the Year has been described as clinical expert and trusted provider, truly dedicated to serving their patients and families, strong mentor, embodiment of the values of UI Health. Our award recipient exemplifies the values of diversity, equity, and inclusion. They are a strong advocate for culturally sensitive care and consistently ensure that patients and families feel heard, respected, and empowered. Their ability to explain complex medical plans in clear, compassionate terms have made them a trusted guide for patients and their families during some of the most vulnerable moments of their lives. Our award recipient has been an advocate of pushing forward the application of new technology and adding to our comprehensive clinical services. She has been instrumental in creating the cardiothoracic surgery robotic bronchoscopy program, providing diagnosis and cure for lung cancer patients in the same day under one anesthesia session. This work is being done in close collaboration with the Pulmonary Medicine Division and Oncology, as well as the lung screening program. She mentors CT surgery PAs and nurses in the ICU and OR, ensuring that evidence-based practice remains at the core of our institutional standards. She contributes to research and quality improvement efforts and plays an essential role in our department's data management for the Society of Thoracic Surgeons database. Marta has led quality improvement initiatives and has reduced CABG readmission and postoperative wound infections. Marta's ability to inspire and support those around her embodies the values of UI Health and makes her an outstanding provider. These are just a few examples of our award recipient. It gives me great pleasure to congratulate Marta Seaman as our 2025 Advanced Practice Provider of the Year.
Hi guys, yeah, come on up. Hi, welcome, good morning. Mom's got a really big check. Congratulations, Martha. Either way. Thank you. All right, well, our last set of nominees that you will meet today will be for our Attending Physician of the Year. If you can, please come forward when you hear your name. Michelle Baines from Dermatology, come on down. Michelle embodies the true spirit of medicine through her tireless work ethic and her unwavering passion for patient care, especially for her pediatric patients. She has contributed significantly to resident and medical education throughout the years, as is seen in her didactics, grand rounds, and hands-on teaching at clinics on a daily basis. Michelle, congratulations. Next up is Megan Harding, Pediatric Critical Care. Megan is deeply committed to patient care, passionate about education, and continuously pushing the boundaries of innovation and medical training. Her mentorship of residents pursuing fellowship is comprehensive and deeply impactful. Her door is always open, and her support is unwavering, making her a cornerstone in the professional development of our trainees. Congratulations and thank you. Next, let me introduce you to Aisha Hassan from Maternal Fetal Medicine. Aisha is empathetic, compassionate, listens to her patients, and understands her patient's perspective. She is a staunch advocate for our diverse patient population. Her sensitivity to the social determinants of health and her relentless efforts to remove barriers to care underscore her integrity, fairness, and inclusivity. Congratulations. Next, let me introduce you to Jessica Herrick from Infectious Disease. Jessica is a true catalyst for positive change and a driving force behind significant improvements in patient safety. Her leadership of the CLABSI task force highlights her ability to drive transformational operational change. UI Health saw a 44% decrease in hospital-acquired CLABSI from FY23 to January 2025. Currently, central line blood culture rates have decreased from approximately 9% to less than 2% for the organization. Congratulations. Next up is Anna Morrow, internal medicine and pediatrics. Under Anna's leadership, the pediatrics clerkship has undergone several changes to strengthen the didactic curriculum, clinical experiences, and preparation of students for shelf exam. She has championed efforts to better align student preparation with clinical demands and shelf exam performance, despite persistent challenges in resource access. Through all her endeavors, Anna remains grounded, generous, and mission-driven. She is beloved by her students and colleagues, and her work consistently improves the systems around her. Congratulations. Next up is Berche Ozigan from Radiology. Berche exemplifies the highest standard of professionalism, expertise, and community engagement within UI Health. Beyond her expert diagnostic skills, she is a critical resource for multiple departments, including ENT, neurology, and neurosurgery, frequently taking the time to review complex cases, contribute to tumor board, and provide invaluable insights that directly impact patient care. Thank you. Congratulations. Next, I'd like to introduce you to Morley Wong from Radiology. Morley has implemented new resident curriculum items to keep the residents on track for board exam preparation, including daily case of the day quizzes and monitor question bank participants with strict deadlines for completion. She exemplifies high quality care in the reading room, using consensus guidelines and the most up-to-date BIRADS recommendations on how she approaches each patient's care. Congratulations. And our last nominee is Fun Zhu from Radiology. Fun quickly became an integral member of the diagnostic radiology team. Her contributions have unquestionably elevated patient care, enhanced interdisciplinary collaboration, advanced resident education, and introduced meaningful innovation within nuclear medicine. She is currently implementing new ways to offer therapeutic nuclear medicine options, including prostate cancer and neuroendocrine tumor treatments, giving patients more access to more non-invasive treatment options that suit their goals. Congratulations. We also then had quite a few physicians nominated that were not able to attend for us today. They are obviously out providing amazing, incredible patient care, but that would be Adam Kosloff, Sarah Messmer, Ryan Nguyen, Ben Vasquez Martinez, Sam Wainwright, Ani Guopuda, and Louis Su. So congratulations to all of them. And now I will turn things over to Dr. Radosta.
All right, it is now time to announce our 2025 Physician of the Year. Our Physician of the Year has been described as an icon of UI Health. Her research excellence, compassion, and commitment to healing recalls the oath of Hippocrates. Into whatsoever house I enter to help the sick. She collaborates with others across all areas to provide excellent patient care and service delivery. Since 2019, she's taught a course at Rush on opioid disorder treatment as part of the ECHO program. She's led the rotation for medical students and residents at the Community Outreach Intervention Program, VAN, the COIP Clinic, and Miles Square Health Clinic. Our recipient has noted the common theme of all of her work is addressing health disparities and developing innovative care delivery models that center on patients. In pediatrics, she has transformed the care landscape for immigrant and refugee children. Her leadership in the Pediatric Global Health Track and the development of a dedicated medical home for unaccompanied minors under the National Youth Advocate Program has brought timely, trauma-informed care to over 130 children. Her mentorship of residents has not only cultivated new leaders in global health, but resulted in the creation of institution-wide training curricula and national presentations. Her impact extends further with the Mogul Migrant Health Team, where she mentors students undertaking needs assessments and advocacy projects for migrant families and LGBTQIA+ individuals. These initiatives exemplify Sarah's ability to empower the next generation of physician advocates while strategically expanding access to developmentally supportive, community-centered care. As clinical lead in the pioneering mobile care initiative in partnership with COIP, she has helped deliver low-threshold substance use treatment and primary care to more than 1,000 individuals in high-risk neighborhoods. Her innovative work led to a mobile multi-mobile unit expansion across Chicago and beyond, offering a replica model for community-based addicted care. Unfortunately, Sarah cannot be with us today. She was accepted into the CDIAS Fellowship in Addiction Implementation Science and is traveling to San Francisco as we speak. We announced to Sarah yesterday on the screen before she left that she had been selected. She was beyond thrilled and humbled at the honor.
Congratulations to Sarah.
Congratulations.
All right, you can have a seat. All right, well, thank you, everyone. I'd like to now turn things over to Dr. Rosenblatt for a few free remarks. Dr. Rosenblatt. Sorry.
There we go. Thank you very much. It's really just a spectacular day, as has been mentioned. This is a wonderful day for all of those who work at UI Health. It's a celebration. We get to celebrate a bit, but this is perhaps our biggest celebration. I'd like to congratulate our award recipients again: Physician of the Year, Dr. Messmer; ABP of the Year, Marta Semin; Resident of the Year, Dr. Chelsea Herbert; Employee of the Year, Terrell Funkhauser; Monique Long, our Joseph Abraham Leadership Award recipient; and our first ever Program Coordinator of the Year, Caroline Marchuski. So let's give them all another big round of applause. And of course, another mention to our Award of Merit recipients: Carrie Best, Denise Fields, Ryan Frank, Maria Gomez, Dina Johnson, Dawn Magiera, Charlene O'Shea, Sarah Rios, Marie Romero, and Victoria Smith. So another round of applause for them as well. Again, these Award of Merit recipients represent UI Health amongst our wider campus community for exhibiting excellence in service, commitment, and dedication to our institution. We're grateful to all of our honorees today for their commitment to our mission of advancing health for everyone through outstanding clinical care, education, research, and social responsibility. These providers and staff are here today because they truly live our mission and help us do so as well. They're dedicated to making a lasting impact on our patients and the communities we serve, as well as their colleagues here at UI Health. They're dedicated to supporting these colleagues by working together as one, guided by our I Care values. They exemplify and embody our mission-driven as one ethos. And to our guests today, this mission as driven as one is our strategic theme here at UI Health that brings us together. And it's how we utilize our I Care values of inclusion, compassion, accountability, and respect, as well as excellence, to guide all of our actions and our purpose in supporting and achieving our goals. It's ultimately the backbone, the foundation of how we collaborate with our colleagues to help our patients. It's the foundation of how we deliver our excellent care, excellent outcomes, and excellent experiences for our patients, and our guide to ultimately achieving our long-term goals together. All of us here at UI Health are really dedicated to bringing us together in this way. And we are honored to recognize these colleagues here together for all that they do. We're grateful for their leadership and their role in strengthening our shared purpose and bolstering our culture of inclusivity here at UI Health. Congratulations to these award recipients. We hope today's recognition ceremony serves not only as a capstone, but also a foundation for continued collaboration, excellence, and pride in our institution. You are every day an inspiration to all of us who work at UI Health. And thank you for all that you do to make this a wonderful place to work, the best place to work. And congratulations again.
Thank you for that, Dr. Rosenblatt. As we wrap up today, I just have a couple of quick housekeeping, I guess, rules or last final remarks. It takes a village to put on an event like this, and so certainly you see quite a few of our volunteers, certainly from our marketing team taking our photos to the greeters you had at the door, the ones handing out their swag in your bag. But I want to give special acknowledgement today to Maddie Weingart, who's quietly hiding over in the corner. Believe it or not, Maddie's not even been with us for a year yet, and she said, "Oh, can I take on this program?" And I said, "Sure." And so she really was the lead behind putting everything together, contacting a lot of you, and I'm sure you know are very now familiar with her name. So, Maddie, thank you for all that you do. I would like to invite all of our award recipients who received an award today. So our APP of the year, our resident of the year, our employee, our Joseph V. Abraham recipient, and of course our GME coordinator recipient. If you all could immediately after the conclusion of the ceremony come up front so we can take some official headshots, because we're going to splash you all over our social medias and the hospital and screensavers, and you're about to become really famous. We'll go ahead and do that. Haas and Jack are also going to stay around for a little bit as well. And so I know there's many families. We got a big stage. We can move the podium and get you all in. We would love to take photos. So if you'd like to stay with your photo, I know a lot of teams are here together. Come on up for a team line. Just kind of queue around, and either Haas or Jack will be happy to take a photo. Photos will be loaded, and we'll share out a link with you all by next week. And with that, I just want to say once again, thank you all for joining us today. This is once again just my absolute favorite day, and I wouldn't have missed it for the world. There is a light lunch buffet out in the hallway, so you are welcome to please enjoy and come on back in and sit down. If any of you are a fan of balloons or have children who would love them, you are free to also take the centerpieces, because if not, we have a lot of popping to do. So with that, again, congratulations, thank you, and enjoy.